Hello everyone, and welcome to our virtual educational program. In this video, we will be discussing how to motivate your loved one. Throughout this presentation, we will talk about some strategies and tips for supporting and inspiring your loved one's everyday life. Before we dive into specific strategies, let's first understand the significance of motivation in the recovery process and in everyday life. Motivation acts as the driving force behind positive change, and it plays a crucial role in maintaining progress. When individuals feel motivated, they are more likely to engage in treatment, participate actively, and overcome obstacles. As caregivers, part of your role is to cultivate and sustain this motivation. To do so, it is important to understand why your loved one may not feel motivated and how their specific condition or health concern is impacting their motivation to engage in beneficial activities. For individuals with a stroke or brain injury, the path to recovery can feel endless and full of obstacles to overcome. While recovery is certainly possible, it takes a lot of hard work, dedication, time, and patience. As such, it is not uncommon to feel helpless and out of control when experiencing an enormous life change, such as a stroke or brain injury, so staying motivated and dedicated to recovery can be extremely challenging. Additionally, apathy and depression, often experienced among individuals after a stroke or brain injury, can further exacerbate these feelings and can negatively impact one's motivation. Moreover, individuals with a brain injury may also be experiencing adenomia, which is a symptom caused by an injury to the frontal lobe, and it entails difficulty with initiating or participating in an activity. This makes it even more challenging for survivors to feel motivated due to changes in cognitive function. Nonetheless, motivation is an essential part of stroke and brain injury recovery. If an individual is not feeling motivated, keeping up with their exercises, engaging in everyday activities, and socializing with others will be difficult. For individuals with Parkinson's disease, a recent study found that about 40% of people with PD experience apathy, a motivational disorder in which people have trouble getting interested in daily activities. It can show up in three forms. First, cognitive apathy involves loss of interest and curiosity in new things. Emotional apathy involves a lack of passion or reaction to news that normally would evoke emotion. And lastly, behavioral apathy is trouble initiating activities and a need for others to prompt one to complete tasks. In fact, it is important to note that motivation for individuals with stroke, brain injuries, or Parkinson's disease does not come from within. Rather, it comes from the people around the survivor, and they include close family, friends, exercise groups, and caregivers. Now, let's explore some effective techniques to achieve increased motivation in your loved one. First, building a supportive environment and creating an atmosphere that fosters motivation and positivity. The environment we create for our loved ones greatly influences their motivation. Here are a few suggestions to build a supportive atmosphere. Encourage open communication. Foster an environment where your loved one feels comfortable discussing their challenges, emotions, fears, and progress. Active listening and empathy are key. Celebrate milestones. Acknowledge and celebrate both small and significant milestones. Recognize their achievements and encourage them to appreciate their progress. Surround them with positivity. Infuse positivity into their surroundings through uplifting messages, inspiring artwork, or motivational quotes. Create an atmosphere that promotes optimism and hope. Second, setting realistic and achievable goals and tracking progress. Setting realistic goals is essential to maintain motivation throughout the recovery journey. Here's how you can help. Collaborate on goal setting. Involve your loved one in the process of setting goals. Encourage them to express their aspirations and desires while ensuring the goals are achievable and aligned with their recovery plan. Remember to use SMART goals, which are specific, measurable, achievable, realistic,
and time-bound. For example, for a caregiver who wishes to reduce stress, their goal may be, I will implement a plan that helps me reduce my daily stress by practicing mindfulness and making time for myself at least twice a week. The plan will include a schedule of activities that can help me relax, such as yoga, journaling, and walks in nature. And for an individual with Parkinson's disease who wishes to improve their balance, their goal may be to improve balance and stability. I will increase my ability to stand unsupported for 30 seconds within 3 months by engaging in targeted balance exercises regularly, under the guidance of my trainer at Neuro Wellness. Break down larger goals. Sometimes large goals can be overwhelming. Break them into smaller, manageable steps. This helps your loved one experience a sense of accomplishment as they achieve each milestone along the way. Monitor progress, keep track of their progress together. Use visual aids such as charts or calendars to help them visualize their achievements. Regularly reviewing progress will motivate them to continue striving. Please refer to our resources for a helpful guide that can help in creating smart goals and in keeping track of progress.
Third, providing emotional support. Emotional support is a powerful tool in motivating your loved one during their recovery. Here's how you can provide it effectively. Show empathy and understanding. Validate their feelings and emotions. Let them know that their experiences are acknowledged and respected. This creates a safe space for them to share openly. Be patient and compassionate. Recovery can be challenging and filled with ups and downs. Show patience and compassion, even during difficult times. Your unwavering support can make a significant difference in their motivation. Offer encouragement and praise. Be their cheerleader. Offer words of encouragement and praise their efforts, no matter how small. This positive reinforcement boosts their confidence and reinforces their motivation. Fourth, encouraging self-care and healthy habits. Self-care and healthy habits are crucial for maintaining motivation and overall well-being. Let's explore some ways to encourage these practices. Prioritize self-care. Encourage your loved one to engage in activities they enjoy, whether it's reading, spending time in nature, or practicing mindfulness. Taking care of their physical and emotional needs will help sustain their motivation. Support a healthy lifestyle. Promote regular exercise, a balanced diet, and sufficient sleep. These fundamental aspects contribute to their physical and mental well-being, which in turn enhances their motivation and recovery process. Foster a routine. Establishing a structured routine can provide a sense of stability and purpose. Help your loved one create a daily schedule that includes self-care, therapy sessions, hobbies, and social interactions. And lastly, encouraging peer support and community engagement. Peer support and community engagement can significantly impact motivation and recovery. Consider the following. Connect with support groups. Encourage your loved one to join support groups where they can interact with individuals who share similar experiences. These groups provide a sense of belonging, empathy, and inspiration. Engage in community activities. Encourage your loved one to participate in community activities or volunteer work. This helps them regain a sense of purpose and contribute to something larger than themselves. Celebrate progress together. Attend events or gatherings related to their recovery milestones. Sharing these experiences with peers and the community reinforces their motivation and builds a supportive network. In conclusion, as caregivers, you have a vital role in keeping your loved one motivated throughout their everyday life. By creating a supportive environment, setting realistic goals, providing emotional support, encouraging self-care and healthy habits, and facilitating peer support and community engagement, you can make a significant difference in their motivation and ultimate success. Thank you for your attention during this presentation. We hope the information provided was helpful to you.